If you can edit
today.
it and maybe add some hair for me, that'd be great.
Oh, can I put some wigs? Can I try on some wigs and stuff?
Yeah, yeah, go for it.
That would be awesome. All right, everybody. So just to kind of like preface this whole conversation, right now I'm talking to Dr. Gibbs. Say hi, Dr. Gibbs.
Hello, everybody.
You're on Burst TV. So I've been meaning to talk to you for a while, and I've been like brainstorming, like where do we start? Like, he's so funny. I first saw you, actually, I first heard your song. Someone else was using your audio on their TikTok, I think, and it was this one, just so everybody can appreciate this.
Hey, Mr. Brittany, I think we got ourselves a banger. Yeah, Dr. Gibbs. Nothing on that eat no birds. Make your teeth feel so clean.
Good song.
I mean, that's so good. And I was like, he is my people. I need to speak to this man. So thank you for that. I know you're on your lunch break. This is a dentist. Like, he's super busy. He barely has time to pee. So I don't want to take too much of his time, but he was kind enough to just like come on very randomly. And I want to get to know you. Everybody else probably does too. So we're going to do like rapid fire questions, and you were like on it. You scheduled this right away.
Yeah,
So
I rapidly scheduled it.
I like it. Get it done. So
Yeah.
I'm gonna jump right into these questions. Okay.
Okay.
All right. What's the weirdest thing a patient has asked you to do on their teeth?
They have asked me to put in some initials.
Oh, that's not too. Now, was it like carved in or blinged or like what?
Yeah, they wanted me to carve it in, and then another request was to add like some bling onto their teeth, like some little bit. They want me to basically bedazzle their tooth.
Yeah.
Yeah.
Did you have real diamonds, or were these like Swarovski crystal kind of things? Were you prepared for this?
They're more of like the Dollar Tree kind, you know, because as you're most likely, I mean, yeah, they bring them in and they have like this big old kit of diamonds, and of course they're not real, because I don't think anybody be walking around with that many diamonds at a community health center asking me to stick it onto a tooth. So no, I didn't end up doing it because I don't know. I think that tooth jewelry is nice if it was like a grill, something that is more broad that can actually go on multiple teeth. But having one little tiny piece bonded onto a tooth, you can easily lose it if you bite into an apple, a sandwich, whatever it is. It's popped off, you swallow it. Maybe you're sleeping and you aspirate it and breathe it in. Now it's sitting in your lungs. So it was too dangerous for me to do. But I have grills for me. Yeah, no.
Yeah, they're cute, but you don't need that headache.
Yeah, I'm sure they got a filter for it nowadays.
Right? Yeah, exactly. If it can put eyebrows and lipstick on me. Okay, favorite procedure?
Extractions. Unfortunately, I like doing surgery. I like taking teeth out. Wisdom teeth are always really, really fun to do, but it's always a puzzle to try to take teeth out because the roots sometimes are shaped in different ways and whatnot. But the best thing is, you know, a patient comes in excruciating pain and I'm able to numb them up and remove that pain from their mouth. And it's like instant gratification. It's like instant pain relief for the patient. And it makes me feel good that I can do that.
So it's not like Little Shop of Horrors. You're being all creepy, just like to rip body parts out. It's more that you're trying to help people.
Oh, no, but that's what everybody thinks we're doing. Their mind starts to go crazy. And that's where it gets important on trying to explain what it is that I'm doing. Because if not, I'm letting the patient's mind wander off and thinking I got a hacksaw and I'm just hacking away at their teeth and whatnot. Yeah.
Okay, what's one thing that just grosses you out?
When I find like 2-week-old lettuce inside people's mouths, it's really nasty. Another thing I would say is when patients who have dentures come in and they remove, let's say, their upper denture and they got a whole bunch of white mashed potato stuff on the inside and they're like, oh, and they just lick it all up and then they hand me their denture. That kind of.
They hand it to you and you don't have gloves on or anything? Yeah.
Yeah, no, thank you.
Okay, when's the last time you changed a toothbrush?
Change my toothbrush. Well, I actually have a burst toothbrush, and so I change my toothbrush head every 3 months.
Oh, good answer. I like that. Ding, ding, ding. Major brownie points. Okay, how many fillings do you have in your own mouth?
Fillings, I've had them done when I was younger. They are amalgam, the metal fillings, and I have them on my back molars. I think I have 4 fillings on my back molars, 1 on each one.
All right, cool. So at least you've been in the chair a few times.
Yeah.
Honestly, do you floss every day?
I floss every single day, but I don't floss twice a day. I floss at night before bed because I personally feel that's the most important time to floss your teeth and to brush your teeth is at night. Floss first, brush next, go to bed.
Good answer. All right. What's your best quality?
I would say my communication and personality. I find that the first part of interacting with anybody or with patients in general is how they feel with your attitude towards things. If you come in with a very dry personality, they're kind of like, I don't know if I want to work with this guy. But I make them feel comfortable. I make them feel welcomed. I have fun. That's one thing that I enjoy doing is just having fun. I'm constantly just joking around. Even the most serious person I can make laugh in my chair.
Love that. Love it. Okay. Do you ever blow your nose in the shower?
Do I blow my nose in the shower? Absolutely.
All right. What's the funniest way you've ever gotten hurt?
The funniest way I've ever gotten hurt. Minus all the times that my wife has accidentally knocked me in the face when we're sleeping, I would say, I don't know, at a swimming pool, maybe trying to get out and I slip and scrape my knee on the edge of the swimming pool or something. That would be a funny thing because I just imagine seeing myself slipping and falling and my facial reaction. I don't know. I would say that would be it.
Don't you wish you had cameras set up for stuff like that?
Oh yeah, definitely. That's the best. Anytime my wife falls or something happens, I instantly laugh. And I'm like, I'm sorry. Are you okay?
All right. I have one last question, but I'm going to save that until the end. So I know I asked you to do this like totally last minute. Do you have any questions for me?
I do have some questions for you, actually. I had them written down, but I don't have them in front of me right now, but I think I have them remembered. Let's see. What was your favorite thing being a hygienist?
Okay. So, when you have like the grumpy, scared or angry person, and then by the end of the appointment, like you're laughing and having a good time about it. You kind of win people over. That was my favorite.
Yeah, that's awesome. And what is the nastiest thing you've seen in a mouth?
Curly hairs that didn't belong to the person.
Oh, yeah.
It was like really up there. We had to do a little flap and explode it. And some fingernails. Yeah. That's probably the weirdest.
That's pretty nice. How many chickens do you have?
I have 3. I have 3 hens.
And how many eggs do you get a day?
1. Stella's the only one that's laying for me right now, but the other ones, they're going to grow up and be good hens. I'm feeding them a lot.
And why do you like Burst?
Oh, okay. Well, the products just work. I mean, they work really well, but it's really the community behind it. Like I get to test products before they ever come out to market, and it just makes me feel good all the way around. They're not super expensive, and so it's just an easy thing for me to share with other people that I can nerd out on.
Awesome. The next question was, why are you not famous on TikTok yet?
I don't know.
You know what I'm saying? Like your videos are hilarious.
I see some stuff, right? The weirdest thing that I've seen lately is the ASMR where they're just like doing this kind of stuff. And I'm like, I'm not saying that's not a thing, but it's not funny. It's not entertaining to me.
I think an idea that you should do is, I think you'd be good at it is, aside from the ASMR stuff, I think that if you made like one of those sleep videos where you're like whispering, like, listen to my voice as I talk to you about how to brush and floss your teeth.
I've done some voiceovers, and I'm thinking maybe I'll just go that. I need to make it weird enough where it's like oddly satisfying and kind of cringy, where people are just like, I'm not sure why I'm watching this. I haven't cracked the tip.
Yeah. I don't know. Oh, when was the last time you went to the dentist?
It was like 5 months ago. Yeah, 5 months ago. I always make my appointment when I leave because I know my own patients wouldn't come in unless they made that appointment that day. So once it's in my book.
That is very true. Android or Apple?
Oh, Apple. I'm an iHorse all the way.
Okay. I think that concludes my questions.
Awesome.
I don't have any other ones. Maybe I might come up with one that I'll save later on.
Okay,
I don't know.
So, okay, my last question. I know you have a nonprofit, so I want to know, like, what is your passion? Like, why? Because people always ask me, like, why do you do TikToks, or why do you sing? Or so I would ask you, like, why do you have a YouTube channel? Why are you making parodies of dental related stuff? Like, what's the point? Why are you doing this?
I have a passion for entertainment, and I have a passion for helping people, and I enjoy music, and I found a way to kind of marry the two together. And that's how I created the nonprofit Entertainment Healers. And that's essentially what we do. We do entertainment, and we do healthcare, and we give education and information to all of our audience members through an entertaining way, so that the information is better retained. Because if I sit in front of you and I just say, make sure you're brushing and flossing your teeth, you know, like Ben Stein would with a monotone voice, it doesn't sound very nice. It sounds actually very boring, and it'll probably put you to sleep. And the information is not retained. But if I'm standing in front of you and I got a beat and I'm telling you about like oral infections and things that you can find in the mouth, like some of the first signs of diseases show up in the mouth, like cancer, HIV, and diabetes. If not detected, to become untreated. Believe it or not, a single tooth can get infected and cause you to become septic. Have you seen like you was epileptic? You know, things like that. You're like, what the heck did he just say? Let me replay that. Let me listen to it. And there's a nice beat in the background, and you're listening to these things. And you're like, wait, you can see HIV, signs of HIV in the mouth. You can see oral cancer. You can see these things. Like, how does it affect the rest of the body? Because now I put it all in a different format. And so I have fun doing it, and people actually enjoy watching it. So, which is surprising that they like watching me. But I just keep going.
Listen, I'm gonna put all your I'm gonna put your YouTube channel. You guys gotta go follow his YouTube channel, because he needs to get to at least 1,000 so I can tag him. Because I can't, like, YouTube is weird like that. You can't tag people unless they have 1,000 subscribers.
And I started making like I started a series. It's called Floss Up. I think I have 6 episodes now, and I go through and I break down, you know, what's a root canal, what's a cavity, how are we filling these teeth. I show examples. I try to explain it in ways that's easy to understand without using these crazy big words, and everything just goes right over your head. So that series is called Floss Up, and I believe I have 6 episodes. They are all on YouTube. Feel free to check them out. And there's a lot of information on there. So if you have questions about what a root canal is and what we do during our normal exam and all that fun stuff, it's all there.
Nice. Yeah. I mean, Google is like this huge search engine. It's so easy to find information that's easily digestible. I'm right there with you. That's my favorite part of my job, is that I'm just sharing information, and I'm here available to answer questions for people. So cool. So on your website for the nonprofit, you said that someone that influenced you was an entertainer, but that they were also, what did you say? Oh, they were a healer as well. Were you talking about a specific person?
No, not necessarily. I kind of was referring to myself. You know, it's like I prior to dental school and prior to even college, I was actually a DJ. I was like a professional DJ. I worked for a really big company in Sacramento. We did stuff for like the Sacramento Kings, a lot of major events. I think MC Hammer had an event that we DJ'd for. So, you know, I did a lot of high school dances, weddings, and I just loved being in front of the crowd. And so when I attended college, I was a biochemistry major, and you know, there's this chemical equation. It's called Gibbs free energy is what it's called. And so essentially in a chemical reaction, there's a set of free energy that kind of helps the whole equation kind of continue to go. And so the chemical reaction continues to go because of this free energy. And so I was like, well, wait, when I'm in front of a crowd, I get this free energy from them, and it keeps me going. And so that's where Gibbs came from.
Oh,
and so
I love that.
Initially, I was
thinking maybe you were just in the witness protection program, so you just came up with that name.
Yeah. You know, that I can't say anything. I can't confirm or deny that.
I'll delete
but yeah, that's where I used to be DJ Gibbs. And then after I graduated dental school, I became Dr. Gibbs. Nice.
I love it. All right, listen, I'm going to let you get back to your patients. I don't want to be the person that's responsible for you not taking your potty break. We want you to be happy and healthy. But listen, to everybody watching, if you have any questions for Dr. Gibbs, if you want him to come on again, like, leave them in the comments, and we'll do a second one. I'm thinking we need to do some type of parody. I'm a good backup singer.
Let's do it. I'm a good backup singer. I think you could be a lead singer because I'm horrible.
I mean, I have some ideas. I think we need to make this happen. So if you guys have suggestions for songs, we can do a parody as well.
Let's do it.
I'm up for the challenge. All right, Dr. Gibbs, have a wonderful day. Thank you so much.
Thank you. I appreciate you having me on.
What should people do if they found this mildly entertaining?
I think that they should like, share, and subscribe to the channel. That's what I think.
Maybe just let somebody else hear it too. That would be good. Just show some support for our time.
Yeah, and leave us a comment and let us know what you liked, what you didn't like, or let us know if you have questions about something. We're here to entertain, educate, and inform, and have fun.
Exactly. And we're complete dorks with thick skin. So there's no right or wrong answer or comment. So leave them below.
Just don't ask how I lost my hair. That's a very sensitive topic.
No, well, I'll fix that for you. I told you I'll fix it.
Oh, yeah.
Stay tuned. I'm going to fix his hair situation. It's very traumatic. I don't want to talk about it. All right. Thanks, guys, for watching Burst TV. We'll see you next time. Cut.
Burst. Make your teeth feel so clean. Improve your smile and your oral hygiene. Burst. Let me see your chips. Burst. Burst. Make your teeth feel so clean. Improve your smile and your oral hygiene. Burst. Let me see your chips. Burst.